Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568, and my phone number is 408 687 1899. Email address homeomedicine homeomedicine@yahoo.com. Anytime, if ever you are suffering from any disease at any age and you are desperate from the treatments, please call me for your second opinion of your disease. And if ever you want to be treated with the scientific homeopathic approach, you can call me at 408 687 1899. As you know, in this lecture series, we are regularly delivering lectures on how the life was created, how it was developed, what were the complications life faced during this phase from beginning to end. And step by step, we are discussing each and everything which is mainly concerned and which is mainly of knowledge for each and every person, because it's our life and everybody passes through that life in their lives. And even not only himself, but their next generation, their next generations, and ultimately, you are responsible for that, because those generations are passing in your hands, and you have already experienced all these difficulties what your new generation is facing at this time. If you are too enough aged that you are not passing from all these and diseases, because diseases are also, most of the diseases are based on the age factor, and most of the diseases are not coming after that a particular type of age for a particular disease of a type of a disease has expired. Under those conditions, if you learn, if you have knowledge about all these things, though you have passed that phase, and you have passed that phase when you were not aware of all these things, but in whatever way, with the guidance of the parents or with the guidance of the doctors at that time and with the nature's itself protection, you have passed that phase. But at this time you are having experience of those conditions, and it is only based on the experiences, but you do not know the details of all those things, how these happens, and how long they lived with the life, what are the complications in these conditions. That we are giving knowledge to you in these lectures. Here in these lectures, we are systematically discussing diseases of each phase of life step by step. We have already discussed about the complications during mother's womb life, when it was during mother's womb, and after that, after coming from mother's womb out, which we called the born. The person is born, life has started outside from the mother's, and at every step, this life faces many of the complications. And if ever it fails, we have to pay a big price for that. But if we are competent and we know about that one and we have knowledge about that, then we can save the lives. And that is why I'm giving these lectures systematically, not jumping to hit and trial methods, not jumping to only the particular diseases, so that I can just do my business and I can do that. It's not my business. No, my business is the awareness, public awareness. I want to make you aware about all those things which you or your loved ones are facing in the coming life. Therefore, you must be having a knowledge about all these things so that you can take care of them properly whenever they suffer from this one. Though you have forgotten in your life what had happened, but even then, these are even it's possible that you may not have suffered. It's not necessary that everybody has to suffer from all the diseases. No, it's not. And then, even if you have suffered a disease, even then, sometimes for your childhood diseases, you forget all those. How was they happened, how they were cured, and what was the complications, how you faced that, because it was up to your parents. They know about that one. But now, as you are parents, and your loved ones are passing through that phase of a particular disease, and because diseases occurred according to the age factor as well. So now you are responsible for this phase of your loved ones, that they may suffer. And if ever they suffer, you should have a sufficient knowledge about that, so that you can manage them well and until they are cured. And you can take care of them, you can supply them the required medications by the help of the doctors, or if you know how to manage all those things, you can manage it yourself. So in this phase, when we started this chapter, we started that first of all, there were many dreadful diseases with which many of the lives were gone. Many of the newborns were died in numbers and numbers. But now, as the medical science has acquired the knowledge about those things, medical science has developed a type of treatment that is known as immunization. And if you know about the immunizations, yes, you will take care of your loved ones, newborns, kids, and after that, their life when they are suffering from all these things. And even if they are not suffering, even then, as per a routine, you will follow the instructions of the immunization procedure. And if you do that, there are very few, very less chances that your loved ones will suffer from those diseases. They will be saved from that one, because you have taken care properly and timely, in timely fashions. And therefore, it is recommended by the medical science that since beginning, since the child is born, and we have already told you about some of the diseases that you have to give the vaccinations, even in the first or second month of their life. And after that, a sequence has maintained after approximately 2 months, that each and every vaccination for the immunization should be given to the children, so that various diseases which were dreadful in the previous life, now they are not dreadful. We are able to save the children from those dreadful diseases. In this way, after that, we are passing to a second phase of the life that was known as toddler's phase. And in this toddler's phase, though many of the diseases are the same, but some of the diseases some of the diseases which only occurs during this phase, we are discussing all those things systematically. The first thing, which starts in the newborn age, because the newborn age we have considered it from up to the first 12 months, means born till first 12 months, 1 year. And in this 1 year's phase, the first and foremost thing, which is inevitable, we cannot avoid that, that is the period of teething. And in the last lectures with Punjabi and Hindi media, I have described about the teethings, what teething is, what does it mean, what are what are the types of What are the types of teething? Naturally, and then how we can manage those type of teething periods in the life. And here, when this starts after the newborn's age of 5 or 6 months, it's the normal period. There is variations that yes, even if the first teeth erupts from fifth to eighth month, it is considered as a normal period. But mostly within fifth to sixth months of the life, after the intrauterine life, after the child is born, because there was one exception I told you that there are some examples in the medical science that children's born with one or two teeth when they are in the mother's womb, and they born with that. It depends upon their metabolic rates, and with that one, the metabolic rates has developed teeth in the gums before they born. But these are rare conditions. Mostly and normally, this is the phase of fifth and sixth month of life after it has born. That first teeth should erupt, but sometimes it may be late because of various other factors, the deficiency of food materials or deficiency in assimilation of the food materials in the bloodstream, and the third one, the distribution of the required food materials for the eruptions of the teeth is not supported by the system, is not transported to the place where it is required, means in the jaws for the formation of the teeth, though it is circulating into the blood. Normal calcium, potassium, whatever is required for the formation of the teeth, it is circulating, but it is not in the sufficient quantity which is required for the formation of the teeth. In this way, the assimilation is the second phase. First of all, if there be any deficiency in our food materials, first of all, if a child is not having any erupted teeth at the age of 5 or 6 months, every patient should be aware of this one. Every mother, especially, should be aware of this one. If his child is not having first teeth at the age of fifth and sixth month, she must consider the diet. First thing, the diet. What diet she is giving to his children, whether she is giving her own milk only or whether she is giving some other food materials like formula milk or some other things with the advice of the doctors or pediatricians, your doctor. So in this way, if the food material is not supplied in a sufficient quantity, because as a child advances in age, mother's milk is insufficient to compensate the requirement of the developing body of the newborn. Day to day, its dose is increasing, its food material requirement is increasing, demand is increasing, which is not fulfilled by the mother's milk. Therefore, please be note that after fifth or sixth month, if you see your child is not erupting teeth, even the single one, then you have to add to your milk. If you are nursing your child, you have to add something extra to your milk, extra to the food of the your child, so that whatever is the requirement of the system at that time for the eruption of the teeth should be compensated. It's not only because many times it has been noted that mothers, they give their milk even up to 8 9 months, even 1 year continuously. They are giving their own milk to their children. Yes, you may, but side by side, you must be aware of that your milk is not sufficient for the growing children's and for the demand of the time at this time, because he has to grow the teeth, and teeth needs more calcium, teeth needs more potassium, and also the vitamin C and other minerals as well, which is not it's not her fault. It is they are not having that sufficient contents even if she's taking healthy food, even she's taking the sufficient minerals in for her diet, but even then, from her diet, they are assimilated into her bloodstream. Then her bloodstream goes in a circulation in her body, and after that, a part of that goes to the fetus when it was in a mother's womb. But at that time, it's not going into mother's womb. It is converted by the lactogenic hormone. It is converted into milk, and that milk is not sufficient to provide the ever increasing demand of the calcium, potassium, and minerals for the formation of the teeth. Therefore, it is advised that each mother, after fifth or sixth month, they should change or they should add. If not, we can say the change. No, if you do not want to change, it's okay. If you want to give your own milk to the children, still, it's okay. But you have to add to her diet, add to his diet. Furthermore, so that requirement of increasing demand of the newborn baby or of the developing baby should be compensated. In this way, the doctor advises that okay, take pears, take smashed potatoes, and all those things they are added time to time to the food materials, and even the formula. Nowadays, it has become a normal routine that every mother, most of the mothers, they do not nurse their own children. They put them since beginning on the artificial milk or the formula milks. But the formula milk, sometimes there are different type of formulas, and even them they are not compensating the demand of the increasing baby. But sometimes, though the formula is having sufficient content, whatever is required for the developing baby, it is there, but there is a defect that the assimilation of these products, the assimilation of these salts from the intestines is not assimilated, and it's not going to the bloodstream for the formation of new plasma and new everything which has the sufficient contents. In this way, we have to watch all those things. First thing, your own milk is not sufficient after 5 or 6 months. You should add something to your formula if you are not giving formula previously. Second thing, if you are giving formula since beginning, that formula may not be sufficient, and sometimes the contents of that formulas are not easily assimilated into your blood, into the bloodstream of the child. Therefore, sometimes it advocated, though your formula is good, though it's a systematically synthetic type of things, and which are easily absorbed from the mesentery, from the intestines. But even then, sometimes we need to change that. We need to change that. The system is addicted to that, and addiction of the system sometimes cannot extract the sufficient contents from that food materials. Therefore, sometimes it is advised, even after taking the formula milk for your newborns within the age of 5 or 6 months, if he is not erupting the teeth normally, it means you need to change these formulas. Your milk, yes, we have already advised that your milk is not sufficient with the increasing age and development of the children. The second thing, the formula milk, you have to change the formula milk. Sometimes some combinations of the formulas are assimilable into the system of the children's, but some type of formulas are not assimilated, because most of the chemicals they support each other. Just as the for the formation of a fibrin, calcium, when it is added to the oxygen, it makes clot, it makes combinations. In the same way, there are some other salts which needs combination, which needs help of some other vitamins. Whatever quantity of the minerals or the vitamins you are giving, if vitamin C is in deficiency, they will not combine, they will not go to the growth and regeneration. And if it's not going to the regeneration, it means teeth will not form. So in this way, it is just an example. It is just an example, and this example may be used even for the other elderly persons when their wounds are not repaired normally, when their injuries are not repairing normally. Yes, we need something to help the body for the regenerations. And here we need basically the regeneration, that what are the salts, what are the minerals which needs to be given to the newborns, so that they can, their food materials are utilized as they should be, or they can help to erupt the teeth in the newborns in the normal age of the 5 or 6 months. So, after 5 or 6 months, be attentive that if your child is not erupting teeth and you have already changed the formulas on the basis of the advice of your pediatricians or of the doctors, or even from listening these lectures, about this thing, that yes, my food is not, my milk is not sufficient and I have changed the formulas, or the first previously given formula was not sufficient to erupt the teeth normally, then I have changed the formula. These two things you have done that. And ultimately, the part is the assimilation of that food materials from the intestines via the mesentery, which is the covering on the intestines. And when the food materials is squeezed, the actual contents of the vitamins, minerals, calcium, potassiums, whatever is required for the formation of regeneration or of the teeth, it is squeezed from that food material and goes to the cisterna chali. I have told you many times that there is a tank along with your vertebral column inside, that is known as the cisterna chali, and everything which you eat is squeezed into the intestines when it is at the range that it is now adjustable, it is now assimilable by the enzymes produced into the intestines, gastric juices, bile, pancreas juices like insulin, and the enterokinase, and many other things are produced in the intestine to make this food dissolvable. And when it's made dissolvable, then this intestine is squeezed. It's a normal factor that's known as a normal motion of the intestine, that is peristaltic motions. With the peristaltic motion, this is squeezed, and the actually content which is required for the regeneration is squeezed out of the intestines and goes to the mesentery. Mesentery is a covering on the intestines, and that mesentery has an attachment with that trunk, which is situated along the vertebral column in the backside, in the lumbar area. And that trunk, cisterna chyli, is gradually filled upward. Ultimately, that link goes to the a vein that lies under our left side of clavicle bone. This bone is known as clavicle bone, from shoulder to the mid of the chest. The first bone just in the neck, that is known as clavicle bone, or in other languages it's known as hasli di haddi. In this way, under this bone, there is a vein which is transporting backward blood from the left side of arm, from finger onwards, back to the heart. And this thing is mixed into that vein, subclavian veins, and ultimately it is mixed into the blood. Now we have reached up to this one, that everything we have changed. We have added to mother's milk something, we have added the formula, now we have changed the formula, that it was not sufficient. And ultimately we know that the sufficient content is going to the blood, and it is being distributed. And where it is distributed, it is distributed to the already set sources for different things. Fat, it is deposited in the chest, abdomen, hips, shoulders, and all that, because there is specific spaces for the specific type of food contents inside the body. And just like I want to convey you that the fat, this calcium and fat is deposited in the intestine, also in the hips. The calcium excess is deposited into the bones. And now there is a time that body needs for new regeneration of the bones, that is the teeth, extra calcium to be transported from the tank, from the main sources, reservoir sources inside the body, and that is intestine, and the other one is the bones, because bones are the rich source of calcium and potassium and whatever can make the bones. And nature tries to, if everything from the intestine, again I'm repeating, everything from the intestine, when it is squeezed, mixed up into the bloods, goes to everywhere, and it is taken up by the sources, the tank, intestine and the bones. And now, if extra calcium is required, if it is sufficient, going to the jaws and it's taking up and the normal teeth are erupting, no problem. But sometimes if there is a deficiency and the child is not erupting all the teeth in normal times, it means nature needs to take it from the reservoirs. Reservoir of the calcium is from the intestine and from the bones, and then nature has to take this. And when the nature has to take this one, then ultimately excessive, yeah, because I have already described all these things, that to take a calcium from the sources, means from the bones, is the work of the parathyroid hormone. Parathyroid hormone is responsible for taking the calcium from their sources, from the natural sources inside the body, storehouse of the body, and distributes it wherever it is required. And if something is wrong with the hormonal balance of the child, maybe genetically or maybe some other reasons behind that one, but ultimately if it's not taken, even then if you supply the normal content of the food materials, even then child will not erupt teeth even at the age of 8 months. It's delayed, it's known as delayed dentitions. But in a normal case, what happens? In a normal case, the nature takes extra calcium extra calcium from the reservoirs inside the body, from the intestine or from the bones, to be transported to the site of jaw, so that child teeth can erupt normally. But this process is also a part of the assimilations, part of transportations. And if it's not done, I told you last time in my lectures that whenever at this age a normal content of the foods are not transported to the normal place where it is required, our homeopathic medicines are sufficient to take that part, and they can cure all these things. The problem, you can say the problems, it's a problem to cure the problems. Ultimately it is the process of assimilations. The assimilation is not proper, assimilation is not sufficient to compensate the loss or demand, basically demand, we can say demand of the increasing of the jaw has an increasing demand of the calcium, potassium, vitamin C, and all that for the formation of the teeth. So if it's not going over there, under those conditions, our homeopathic medicines are playing a wonderful role. None other. I'm not against any science, allopathic, Ayurvedic, whatever it is, but the homeopathic medical science, it's safe, and it has proved its efficacy and importance for the teething period of the children at this time. So I'm saying about the assimilation process. It's a part of the assimilation, that there is a sufficient content in the bones of the calcium. There is a sufficient content because it's going through the formula, it's going through the formula, and we have changed the formula, and we have added some of the food materials which are giving excess of the calcium to the body, and now it is squeezed in excess and stored into the intestines, and as well as to the bones. And now it is being taken from the sources, from the intestines and from the calciums. Suppose you are not supplying excess of the calcium, potassiums, or you are supplying and it is not stored sufficiently into the intestines or the calcium, or the bones are still weak, or bones are still covering their own parts, that at the age of 7 8 months child should start standing with the support of someone. And he started that one. Though he is not increasing the number of teeth, he is not erupting him in a single teeth at the age of 5, 6 months, but within 5 to 8 months, within 3 months, he starts standing. He starts trying to walk with the help of the table, chair, or whatever. But ultimately, when this calcium is taken from the bones, there are two phases, from the intestine and from the bones. If the calcium is taken, it was not sufficient, or it was not assimilated sufficiently from the food materials in that way, because sometimes you have seen that even the weaker children are erupting teeth normally. Weaker children who are they are not given, you can say simply, they are not given the sufficient vitamins and minerals in their food materials. Malnutrition, the word medical term is malnutrition. And the condition of a malnutrition, even then those children grow their teeth normally. Why? Because nature itself, from the body mechanism, takes the excess calcium wherever it is required. It's part of assimilation. It is the part of assimilation. It is the function of parathyroid gland, that it has to draw the calcium wherever it is, because there is a now new demand increased. Just like the new homes are constructed, and the source of generating the electricity is one, and it was supplying the already constructed homes. But now the new homes are constructed, and what will happen? They will place cut on the already made houses and will supply to the new homes. In this way, the body supplies the calcium, potassium, whatever is required for the formation of the teeth from the storehouse inside the body. That is calcium, that is from the bone and from the intestines. In I'm talking about the malnutrition children. If it's not malnutrition, then there is a defect in the assimilations, and that we have already covered with homeopathic medicines. If you do that, and then you will achieve their targets. But if a child is malnutrition and you are not able to provide, you see in African countries, and you see in Nigeria and all those countries, they are malnourished. They do not, they are unable to supply sufficient food materials to their children. Under those conditions, even then they grow normal teeth, and even in normal times, because the internal mechanism of the assimilation process is going on well. No matter whatever, you are not having sufficient calcium for the bones, no, but it is a requirement that you have to. You will learn that now the government is taking up some land from the farmers, and forcibly by law they are taking it. They are not ready to give it, but they are taking it. The same thing happens in the systems. When it is required, system take the sufficient calcium from the storehouses inside the body. Just take the first thing. System takes the excess calcium from the bones, and the child which was starting standing at the age of 5 to 8 months is now again will start falling. Again, that development will stop, and ultimately calcium will be taken from the bone sources, and the child will grow normal teeth. Under second conditions, if this calcium or the potassium or the required materials is taken from the intestine, the primary source, because the first primary source for these substances is the intestines. The first they are stored over there, after it is taken up from the intestines, okay, by the mesenteries, and they stored over there. And if it is taken out from the intestines, then ultimately you might have seen that children are suffering from diarrhea in this age, and that's more dangerous thing, because childs have not a bulk material, because 72% of the body is content of the water, and others are salts. And if the excess water is drained out by diarrhea and all that thing, it will create a big problem, because everything will slow down. circulation will slow down. Every function, you can say, every function of the body, because there are nine different functions are doing going on in the systems. So every function will slow down, and if every function will slow down, it will create a big problem for the life. So these are some of the indications that you must be aware of during the teething period of the children's, that first of all, supply of normal food materials. If the food materials supplied is not sufficient or is not being assimilated by some or the other reasons inside the body because of the enzymes and all that, then you can change that food and you can change that formulas. You can change something. First thing, you will add to the mother's milk, then you will change the formulas. Then whatever formula you are giving, even if it's not sufficient, you will change that formula to the other things, because some of the things are not being assimilated normally in the intestines, and the requirement is increasing ever in this condition. And second thing was the assimilation. I told you about that one. And when the simulation and all these things are normal, the third thing I told you, that if distribution is not proper inside the body, though it goes by the blood, but most of these things are stored in the storehouses. And now some has to draw, some has to initiate that the required substances should be taken from the storehouses and should be transported to where they are required. In this way, the progress of the child, developmental facts, that is milestones of the child, you can say, milestones of the child are delayed. And in this way, teething may be delayed, walking may be delayed, or the child may suffer from diarrhea. Under those conditions, you have to treat all those things. And better, in case if you feel, you can consult your pediatricians. And I will advise you, being homeopathic doctor since practicing since 52 years, and have treated thousands and thousands of children in these conditions successfully, even when all other systems were failed and they were not able to cover or to make sufficient move and to make healthy that child, homeopathic medicines are sufficient to take up the part and successfully. So therefore, you have to take that. Now come to the chain of the teeth. I told you in the first month, 5 to 6 months, the first incisor teeth in front, you see that the big teeth, these are known as incisor teeth. The first of all, incisor teeth grow, just to take it a normal, that 5 to 6 months it has grown up. And ultimately, the second incisor teeth will grow up on the upper jaw. It's not a hard and fast rule that only the lower incisor teeth has to grow. No, it may grow up upper teeth, but normally what happens in the most of the cases, it happens that the lower incisor teeth, the first big teeth you see inside, grows first at the age of 5 or 6 months. And after that, after a month or so, means it is taken from, because there is a variation from 5, 6 to 8 months. In this way, the medical science say up to 9 months. But I can say if a normal teeth has erupted at the 6th month of age of the child, then at the 7th month, the other teeth, if the food material and everything is a normal, 7th month, the next teeth should grow on the upper jaw. That's the incisor teeth. In this way, after that, the second incisor teeth will grow within 9 to 13 months, 9 to 1 year, you can say, as in a normal way, it erupts. And both the incisor teeth, upper and lower, the second one, upper and lower, they are completed within 1 year in a normal period, even before that. And in this way, a sequence is maintained, then the premolar teeth are erupted. And there is still gap in between the two incisor teeth, and that is for the canine. The canine teeth grows after the two molar teeth are grown up, on up and down, like that one. In this way, two of both side, right side, two of left side, two of up, two of right side and left side when they grow. And after that, the canine teeth grows. That's a little painful. And why they are named differently? Incisor teeth, they are biting teeth. And incisor teeth have only one root inside. Then the canine teeth, it has still one root, but it has, you can say, two type of things. Root goes downward, which is you can a pinching thing, and the upper, which is known as crown. Let me tell you, the teeth has two main portions. The upper, which we see above the gums, is the crown of the teeth, and which is down inside the you can say the gum and attached to the mandibular maxilla bones, that's known as the root. And the root and crown both have internal cavity, both has internal cavity, that is known as the pulp cavity. And through this pulp cavity goes blood vessels and nerve systems, and everything is supplied by that one. On the crown there is some other painting, you can say, that's known as enamel, white teeth, you can, that makes the teeth white. And if that enamel goes because some of the deficiency in the food materials, even later life, teeth are yellow, teeth are dirty, teeth are black, discolored, all these things happen because of the damages to that enamels. And these are the part of the teeth. So I'm telling about the teeth. Incisor teeth has one root, canine has one root, and the polar that's known as premolars. Premolars mean because the molars jada backside. Premolars are having two roots, and after that they are completed 20 in a number within 24 months of the life. Range, just like I told you, the range is different as described in the medical science, variation of time that gives the length up to 33 months, but that's very late. Even if they are not completed in 24 months specified normal period for the eruption of 20 teeth, that's the milk teeth, they are still late. There is some deficiency. And that it's not that in the beginning there was deficiency. No, it may occur at any time within 2 years of the lives, that now the food material is not sufficient, which is required. Now the assimilation is not normal. Now the distribution is not normal. Something can happen even later on within 2 years if all the 20 milk teeth are not completed within 2 years, 24 months. One more thing. These, technically, these milk teas, this is our vernacular language. We say the milk teas because we suck the milk. But ultimately, their actual name is decidual teeth. They are known as medical terminology, decidual teeth. Decidua. It's not a new name for you, because if you are listening my lectures since the very beginning, you might have listened in these lectures that when a fertilized ovum, after meeting the ovum and sperms, is transported from the fallopian tube to the uterus, at that time, every month, all my daughters, sisters and mothers know that this thing, that every month the inner layer of the uterus is shed off with the menstrual bleeding, and that layer is known as endometrium. Endometrial layer of the uterus shed off at every month with the flood of the blood. But if there is a pregnancy, under those conditions, they transported fertilized ovum from the fallopian tube is inserted inside in this endometrial layer, and then the pregnancy starts. And if the pregnancy is, because every time pregnancy does not start, even if it's fertilized, there is abortion, sometimes threatened abortions. There are different other conditions we will discuss later on this. But now the condition is that why they are called decidualities. So at this phase, when there is a pregnancy, the fertilized ovum from the fallopian tube has been transported from the fallopian tubes to the uterus, and it is inserted there. When it is inserted there, the name altogether inner layer of the uterus is changed. Where it is inserted, because now it's full of blood. Every month, nature prepare the inner layer of the uterus with full of blood and diet and oxygen and everything, whatever is required for the developing fertilized ovum, so that the pregnancy can start. The embryonic stage can get a sufficient food and oxygen from that blood. So nature makes every month that arrangements. So at that time, where this fertilized ovum is attached inside the uterus, this is known as decidua basalis, and that is the basically the basic content which supplies blood to the embryonic stage. That's known as the embryon. Embryonic stage at the developing fetus, you can say, but the name fetus is given later on. And that's the embryonic stage. At the embryonic stage, that is why that portion of the decidua where it is inserted, known as decidua, and because of that, because everything starts generating at the same time in the embryonic stage, and those teeth are given the name the decidual teeth. Let me complete that thing, that the decidua has three different names. I have repeated it many times. Where this fertilized ovum is transported and attached into the uterus, that piece of endometrium is known as decidua basalis. And nature wants to protect it. It is just hanging like a tree, hanging like a mango hanging from the branch of the trees downward. It should not fall because of its weight, because of its loose attachment at that time. It should not fall. It nature itself makes arrangements that the endometrial layer, that is now decidua, endometrial layer makes a curve on both sides and make an arch, make a capsule type things, so that it should be supported from downward. It should not fall, even if its insertion is loose. Even if its insertion is loose, even then it should not fall down. That forms a capsule over there, and that is known as decidua capsularis. Remember, when there are threatened abortions, in case of ladies who are having habitual abortions, every time they are trying for the pregnancy, but even then, first, second, or third month, this is the second month. After that, ladies have abortions. Some lady says, oh, I was having 15 days above than my normal period. I have 20 days above, sometimes even 2 months. And even then, they have miscarriages, abortion. Basically, this term is known as before 3 months, before the 12 weeks, it is known as abortions. And mostly the term is used as threatened abortions. And it is all because that decidua capsularis is not supporting sufficiently to this embryonic stage, plus there is not sufficient attachment over there with the decidua basalis, because it has a lack of vitamin C, it has a lack of calcium and lack of oxygen, because calcium plus oxygen makes the thrombus, may make the clots, make the joint over there. And the vitamin C, it supports like a cement. And then all these things at that time, you will learn from this thing that if ever a lady is having abortion, repeated abortions, it means there is a lack of calcium in her blood, there is a lack of vitamin C in her blood, there is a lack of vitamin K as well as. So all these things, if they are supplied at the folic acid, basically cover up all these things. If the folic acid at this stage is sufficient given in the food materials, it will make possible that it has sufficient calcium and oxygen, it has sufficient vitamin C over there, it will is sufficient vitamin K over there, and they are working over there and they are making compact union inside the capsular decidua basalis. So then there will not be abortion. So the abortion is concerned with all these things. Though there is some hormones which protect, because hormones are the engines, you can say, the activators, which activates the transportation of required, just like I told you, parathyroid hormone transports the calcium from the bones to the place where it is required. In the same way, progesterone hormone transports from the circulating blood vitamin C, calcium, oxygen in a sufficient quantity that their attachment will be strong enough that there will not be abortions. Even though it is supported by the decidua capsularis. But even then, sometimes there is abortion because of all these deficiencies. And deficiency is produced or is covered by the hormones, that is progesterone at this stage. That should be in sufficient quantity if ladies are having. And also, again, I will repeat it, in my 52 years experience of practicing in homeopathic medicines, and especially with the ladies cases for that one. And none of my case has gone to cesarean section, none of my case has gone to this type of complication of the children's. And everybody is recovered with homeopathic treatments. This is even if you apply wherever you are, if you apply homeopathic medicine in this case, it will cover up every case. There will be no failure in this one. Now let us come to the points. The last thing, last remaining portion, because this uh, fertilized embryo is attached only in one place, and its size is only 1 mm at that time, 1 millimeters. Now it has to develop. Now it has to multiply the cells, just like 23 pairs to 46 pair, 46 to 92 pairs, like that. It's developing in this ways. But the whole uterus is still vacant. The remaining portion of the uterus and the inner linings of that uterus is known as decidua vera, which reserves the site for the developing embryo time to time. As it develops larger, it covers up that space, take up that space, and the decidua, which is full of blood, which is full of mucus, which is full of the other contents, squeezes. And sometimes you might have seen during this phase, the ladies are having some type of mucus discharges. That's normal, that's not abnormal. It means the embryonic stage is developing into fetal stage, and fetal stage is taking more space in the uterus. Because of that, it is pushing up the side decidua vera, and side decidua vera is squeezing. Because of that, the mucous blood sometimes it is squeezing up, and sometimes some of the ladies complains that they are dreadful. Oh, why this is discharge? Why there is a blood mixture of discharge? But it's not inevitable. No, nothing like that. It may be a normal. It may be a normal things, and sometimes it may continue throughout the pregnancy, because up to the end, that embryonic stage is developing into fetal stage. Fetal is enlarging in size, and ultimately it is squeezing it. And mostly after 6 7 months, it should not be, because the whole thing has been covered. And ultimately, if it happens after that, yes, you must take some measures to stop that one. Uh, but again, at the end of the pregnancy, at the end of 280 days of the pregnancy, or you can say after 9 months, there is again discharge of this mucus blood mix and everything. It may come up because the plugged mucous membranes, or the inner lining of the cervix of the uterus, is also now being squeezed. It is, fetus is pushing downwards. That's why it's coming up in this way, and it comes up though. So our chapter was I'm sorry, we have taken a long time to explain all these things, but because my purpose is that Everybody, whatever topic I'm choosing and whatever topic I'm explaining to you systematically, you should be aware of the whole circumstances over there, whole area over there, what's going on, so that you should be having a sufficient knowledge of the conditions. We were talking about the teething, and I have told you about that one. The 20 teeth are completed within 24 months. 20 teeth within 24 months should be completed. If there be any delay, even up to 2 years of age, it is considered as delayed. But medical terminology says that even if it's completed within 33 months, the 3 years, nobody pays for that one. But some people are having that long time for the teeth things. But there are some problems. You can cover up those problems when it's not going in a normal time periods. Then you can take measures to cover up all those things by medications for all other sports, outside sports. That all the teeth, 20 teeth, should be erupted in this way. And after that, the phase comes that teeth starts breaking up because the food has changed. First of all, food was soft. It was supplied by the mother's nipples or by the artificial nipples or by the spoons. You are giving some other type of food materials, soft food materials, but now you are changing the food materials. Now you are changing the food materials and he has to chew it, he has to bite it. Ultimately, the nature provides the new teeth in spite of these milk teeth. These are soft teeth and they cannot bite hard things. Nature automatically changes all these things, and ultimately one after the other starts from the same sequence. Incisor teeth breaks up, the new teeth erupts inside down. In the same way, the upper teeth, lower teeth, upper teeth, lower teeth, like that one. In everything is completed, and now this phase goes up to 24 years or up to 25th years, maybe late. But normally it is considered that the wisdom teeth. Normally people say now he is sufficiently intelligent. He's an intelligent person that he has a wisdom teeth grown up. In this way, all the 30, now these are 30 because incisor teeth are increased in number, and the back side, the molar teeth has after the premolar teeth, it has molar teeth and the wisdom teeth. The last one is known as the wisdom teeth, which grows right and left, lower side, lie right and left, and the upper side. The wisdom teeth grown up, and their age limit is up to 24 to 25th years of age, and that's the normal period of the teething plan of the persons. In this way, for the diseases of the teeth and all that, we will discuss later, but because we are passing through the phase of toddler's age. The toddler age having this phase up to the growing of 20 milk teeth. So after that, we will discuss all those things. Today's time is over. I am your host, Gurdeep Singh Sandhu. My clinic address is 9701 Sarah and Court, Dublin, California, 94568. My phone number is 408 687 1899. At any time, for any disease, not only for the teethings and the chapter I am covering. At any time, for any disease, if ever you want to consult me, you can call me. There is no fee of the consultations. And also, if ever you want to take homeopathic medicines in America, I think I have about 3,000 medications in my store. And most of the potencies I'm having that one. So if ever you need any homeopathic medicines, you can call me. And if ever you want to consult me for any disease, yes, you can call 408 687 1899. And if you are far away and you do not want to, though this is a WhatsApp number, 408 687 1899 is a WhatsApp number. But even if you do not want to talk on phone, you can send me an email, homeo medicine, HOMEOMEDICINE at yahoo.com. You will get your answer of the disease of the problem, because I have patients from Canada, from Australia, from England, and also from my country, from the Punjab as well, plus Bangalore, Karnataka, and all that. From various states, people are under my treatments, and they are calling me on email or on phone numbers, and I advise them. And some of the people I'm sending some medications from here, but if ever they can get over there, it's more easy for them. And I advise them whatever I can do for my community. I'm always for your help here. So please, anytime, whenever you need my help, even if you are being treated by any other doctors, good luck. But I can advise you with the second opinion whether your treatment according to nature's process. Everybody knows about that. What's the nature's process? When there was no medical science, how the nature was curing all these diseases. Nature, everybody was not dying. Life was stronger than that one. And how the nature was doing all these things, we have learned about those things. And if ever our medical science follows those rules of the natures we have studied already, and then it will be a perfect cure, it will be a permanent cure. And if ever you are being treated anywhere in the world and you are fed up from something, I can guide you what are the normal procedure of any disease to be cured. What are the normal procedure that your treatment is going in on a normal direction according to the nature. And it is only successful way that if any treatment goes according to the nature will be a successful cure of the patients. God bless you. Rabraka. Tomorrow is a Monday, and tomorrow my programs are on I think three times. Yeah, the first program will be at 2:35 in Punjabi from Radio Punjab. It will be taken up from the Canada, and Radio Punjab will deliver their lecture in Punjabi. After that, the same Radio Punjab will cover up the Hindi portion of my lecture. That will be from the California here. And after 5, that Hindi medium is they cover it from I think 4:35 to 5, 4:35. So after from 5 onward, there will be Punjabi media again, which is taken by the Radio Parvaz from New Jersey. So you are welcome to listen any program, all programs by downloading radio app, that is sabrangstation.com. Sabrangstation.com. You can download and you can listen all the programs. Or you have my Facebook. Everybody is listening mostly on the Facebook, but Facebook is a limited time periods. Whereas all my lectures in thousands in numbers, because since 30 years here in America, I'm delivering lectures on all the radio stations covering Punjabi, Hindi programs and English programs, and all the TV stations, and also the newspapers. Whosoever ask me, give me the lectures, yes, I give them free of cost. So okay, so that my community should be aware of all these things, how this life creates, how this life runs, and how this life is saved from the diseases. I'm delivering all these things. I think this is the my duty at this time, that I should pay back to my community. So in this way, tomorrow I will be busy from 2:35. Yes, I will be busy from 2:35 on wall up to 5:35. And there will be two time Punjabi programs, one time in Hindi programs, in Radio Punjab, Radio Pravas, and also in the Sabrang radio station, YouTube, and Facebook media. I will appreciate you that you are joining all these radio programs here and listening all these things. Thank you. Thank you for listening this one.